Hello, we are into the month of March, and March is the month of colon cancer awareness month. I am Dr. Vishal Mukherjee, cancer surgeon at Open Hill Cancer Hospital, and I will be discussing the role of surgery in colon cancers. So the surgery plays the most vital part in the treatment of colon cancers. And that in case of a tumor of the right colon, we do an operation which is called right hemicolectomy, which is a little bit different from the hemicolectomy which we sometimes need to do in case of a benign disorder or in case of an obstruction or a perforation. In case of a cancer, we need to dissect in case of a right colon, which is called CME and CVL, which is central venous ligation and central mesocolic excision. So while doing this type of right hemicolectomy, we just not only remove the tumor, we also remove the nodes in which the cancer might have spread. So that is very important in removing the colon along with the nodes. If we just remove the tumor only in case of a colon cancer, sometimes the treatment might be incomplete or inadequate. Similarly, in case of a left colon, we do a type of surgery which is called a left hemicolectomy. In this type of tumor also, we need to remove the tumor and the entire nodes or glands in which the tumor spreads. After removing of the tumor of the large intestine, we need to again rejoin the intestine. In that case, we join a part of the small intestine with a part of the large intestine in case of a right hemicolectomy, and in case of a left hemicolectomy, we join the proximal part of the large intestine with the remaining distal part of the large intestine. Thus, the surgery plays the most important part in case of a colon cancer. And nowadays, the minimal access surgery, that is the laparoscopic surgeries and the robotic surgeries, are coming up in case of colon cancers, and it has been seen that the minimal access surgeries like the laparoscopic surgeries have found to have equivalent result in case of outcome as compared to open surgery. And as compared to the patients going home, the patient related pain and bleeding, the results of the minimal access surgeries are far better than open surgery. So the minimal access surgery and the completely curative surgery are the main pillars of the treatment of the colon cancer. After the treatment of the colon cancer surgery, the specimen went for a histopathology or a biopsy report. Through the biopsy report, we get to understand whether the patients are in stage 1, stage 2, or sometimes maybe in stage 3. If the patients are in stage 1, usually we do not give chemotherapies. If the patient is in stage 3, it is must to give chemotherapy after the surgery. And if the patients are found to be in stage 2, on stage 2 we sometimes decide based on the risk factor. There are risk factors which are available in the final biopsy report. If the risk factors are positive, we might need to give chemotherapy. If the risk factors are negative, we may avoid chemotherapy. So surgery is the main treatment. It sometimes may or may not followed by a chemotherapy. So these two are the important treatment for colon cancer. And if someone gets treated with stage 1, stage 2 and stage 3 colon cancer, the survival rates of a patients are extremely good. So if the patients are suffering from colon cancer, please do come to the surgeons or your nearby cancer surgeons or cancer centers and get treated. Thank you so much.